Hey, you got Cheeky Saver here, and this is a vid on EDS and dislocations because this really made me laugh. And they don't even include us. We don't even count, I guess, because the causes of hip dislocation are motor vehicle are the most common, falls from heights, and fractures from other things, from other injuries. I'm gonna have to scroll down here. Okay, here we go. Diagnosis is don't move the injured person, keep them warm with blankets, and that it's an emergency. And it really is for normal people. It absolutely is. You need to go and get it dealt with. Um, my hip pops in and out several times, like in a day. Usually it's a subluxation, but dislocations happen. They happen fairly often. And physio doesn't fix this kind of thing. It's because all my tendons and everything, that the glue that holds you together is all messed up with people with EDS. And last night my hip was dislocated. And what I do, I went on YouTube and I found a doctor who did it, and I went and I laid on the floor and I put my butt up to the bed and I mimicked the motion by lifting my hips up and moving my hip out, and it popped right back in, and I was up walking around. This isn't normal. This is not normal. You can't do this with a normal hip dislocation. Normally you're on crutches for 2 to 3 months. And I was walking around with it like that all day. I just couldn't figure out how to get it back in. I'm so happy I have the ability to get it back in now. But what they say, if I went to the doctors, they're going to knock me out. They're going to possibly, hopefully they'd have the sense not to try and do the thing where they drill the bone through your leg and put you in traction, because that's just going to stretch my tendons and everything out more and make the whole situation worse. So that won't work for me either. 2 to 3 months to heal. No. It hurts, but it's not bad. It's minor. I mean, yesterday I did not take any Motrin. That's all I take. I'll take like extra strength Tylenol as well. I have issues with medications. I can't just take some Tylenol 1s or 3s or whatever. I get really bad side effects or allergic reactions to many of them, so I can't do that. And they are not a route I can even do. So in order for me to go to a hospital, I have to go through hours of waiting. I have to explain to them there's no way in hell you're putting me under. Explain to them you keep that needle away from me with the drugs because I don't want that IV talking to me. And you have to tell them that they're not going to put you in traction afterwards. You have to let them know, and you really have to be your own advocate with this illness. I guess illness is not really correct. It's genetics. It is totally genetics. It's a syndrome. And rehabilitation may or may not work with us. With me, it doesn't matter how strong I am. My hip has always, my whole life, gone in and out, and I've had really hard, laborious jobs too, which turns out to be the exact wrong thing for those who this won't help. I've had jobs in warehouses and stuff where I was hauling around 55-pound bags all day. The boss used to give all the temps to me because they were all guys and they would all be slackers until they saw a girl do it. And then they would get busy. And it was very effective. And I was pretty good at it, but I can't do that stuff anymore. It's taken its toll. So if you have EDS, you need to be your own advocate to make sure they don't take extreme measures where extreme measures are not needed in the hospital. You really need to do that, because the less you end up on those medications and put under, the way better you are going to be in the long run. You're just going to heal faster, you're going to feel better. And this is not for the normal Joe. This is for people with EDS. You got to make sure that you are your advocate, because no one else can do this for you. They don't know enough. It is too rare. So be ready to be your own advocate, and maybe you can get it in on your own. That's your own risk. I chose that to attempt that because mine pops in and out so much, and it worked for me. But you really need to be careful and make sure that you're getting full circulation and everything, or you're like in big trouble. Mine just slides in and out so easy that I just had to get in the right position to make it happen. So do it at your own risk. It's not really a recommended thing at all, but people with EDS, we're a different breed. We just are. So good luck. I hope you have a great day. And you don't dislocate anything today.